Did you know that celebrities like Emma Stone, Ryan Reynolds, Adele, Selena Gomez, Kristen Bell, and Olympic swimmer Michael Phelps all have spoken publicly about living with anxiety? Anxiety can affect anyone, regardless of age, career, or success. But there's an important difference between feeling anxious from time to time and having a mental health condition called Generalized Anxiety Disorder, or GAD for short. Today, we'll explore what generalized anxiety disorder is, how it's diagnosed, and what causes it, and the evidence based treatments that help people regain control of their lives. Everyone worries occasionally. We worry before an interview, a big exam, or an important life event. That's a normal part of being human. Generalized anxiety disorder is different. It involves excessive worry, and worry occurring more days than not for at least 6 months. The worry is difficult to control and often involves multiple areas of life, such as work, finances, health, family, or everyday responsibilities. Instead of helping somebody prepare for challenges, the anxiety becomes exhausting and begins interfering with daily function. The encouraging news is that generalized anxiety disorder is highly treatable. According to the DSM-5-TR, diagnosing generalized anxiety disorder requires excessive anxiety and worry occurring more days than not for at least 6 months. The person also finds it difficult to control the worry. In adults, the anxiety is associated with at least 3 of the following symptoms: restlessness or feeling on edge, being easily fatigued, difficulty concentrating or the mind going blank, irritability, muscle tension, and sleep disturbance. These symptoms also need to cause significant distress or interfere with important areas of daily life. Emotionally, people with GAD often describe feeling like they never can fully relax. They may constantly anticipate that something bad is about to happen, even when there is little evidence that anything is wrong. Many feel overwhelmed by everyday responsibilities and experience persistent worry that's difficult to turn off. This constant emotional tension can become exhausting over time. Many people don't realize that anxiety is also a physical condition. Generalized anxiety disorder activates the body's stress response, which can lead to muscle tension, headaches, upset stomach, racing heart, sweating, and trouble sleeping. Some people spend months seeking medical answers before realizing their physical symptoms are related to chronic anxiety. These symptoms are real and deserve proper evaluation and treatment. GAD also affects the way we think. People often experience racing thoughts, overthinking, difficulty with concentration, and constant what if thinking. Many imagine the worst case scenario, a thinking pattern called catastrophizing. Decision making can become difficult because every possible outcome feels important or potentially dangerous. These thinking patterns often maintain the cycle of anxiety. There isn't one single cause of generalized anxiety disorder. Instead, researchers use what's called the biosocial model. Biological factors include genetics, brain chemistry, and certain medical conditions. Psychological factors include personality traits, temperament, coping style, and previous experiences. Social factors include chronic stress, relationships, work demands, financial concerns, and environmental influences. It's usually the interaction of all these factors, not one single event, that contributes to the development of GAD. Certain experiences can increase someone's likelihood of developing GAD. These include having a family history of anxiety, experiencing chronic stress or trauma, living with certain medical illnesses, and having personality traits such as perfectionism or high sensitivity. Substance use, including alcohol or stimulant use, can also worsen anxiety symptoms. Having these risk factors doesn't mean somebody will develop GAD, but they can increase vulnerability. Generalized anxiety disorder is diagnosed by a qualified healthcare or mental health professional. The evaluation usually includes a detailed clinical interview, questions about the personal and family history, and an assessment of how long symptoms have been present. Medical conditions such as thyroid disease or disorders or certain medications may need to be ruled out because they can produce symptoms similar to anxiety. The clinician also evaluates how much anxiety is interfering with work, school, relationships, or daily life. The good news is that generalized anxiety disorder responds very well to evidence based treatment. Cognitive behavioral therapy, or CBT, helps people identify and change unhelpful thinking patterns. Acceptance and commitment therapy, or ACT, teaches people to relate differently to anxious thoughts while moving toward valued living. Medication, particularly certain antidepressants, may also be helpful for some individuals. Relaxation training, mindfulness practices, DBT, emotion regulation skills, regular exercise, healthy sleep habits, and stress management all play important roles in recovery. Treatment is often most effective when it's individualized to the person's need. Recovery is absolutely possible. Most people experience significant improvement with appropriate treatment. It's important to remember that recovery doesn't necessarily mean never feeling anxious again. Instead, recovery often means learning how to manage anxiety effectively so it no longer controls your decisions, relationships, or quality of life. With the right support and consistent practice, many people return to living full and meaningful lives. There are many misconceptions about anxiety. One common myth is that people with anxiety simply worry too much. In reality, generalized anxiety disorder involves persistent, excessive worry that's difficult to control and significantly affects daily function. Another myth is that somebody should simply relax. If it were that easy, anxiety disorders would cease to exist. Recovery comes from learning evidence based coping skills and, when appropriate, working with trained professionals. One of the biggest misconceptions about anxiety is that it only affects certain types of people. In reality, generalized anxiety disorder and other anxiety disorders can affect anyone. Public figures like Emma Stone, Ryan Reynolds, Adele, Selena Gomez, Kristen Bell, and Michael Phelps have all spoken openly about their experiences with anxiety. Their willingness to share their stories has helped reduce stigma and reminds us that seeking help is a sign of strength, not one of weakness. Mental health conditions do not define a person's potential, success, or worth. If someone you care about is struggling with anxiety, one of the most helpful things you can do is simply listen. Validate their experience instead of trying to convince them that their worries aren't real. Avoid minimizing statements like, just calm down, or stop worrying. Encourage professional treatment if symptoms are interfering with daily life. Most importantly, be patient. Recovery takes time, and having supportive people can make a tremendous difference. If anxiety has lasted for 6 months or longer, is interfering with work or school, or relationships, or causes significant distress, it's a good idea to seek professional help. People who experience panic attacks or feel overwhelmed by anxiety should consider speaking with a healthcare or mental health professional. Early intervention often leads to better outcomes. Seeking help is not a sign of weakness, it's an investment in your health and well-being. Let's review what we've learned. Generalized anxiety disorder is one of the most common mental health conditions, and it's highly treatable. It's not a personal weakness, and recovery is possible with the right support and evidence-based treatments. If you'd like to learn more, visit my Shopify store where you can download a free educational handout on generalized anxiety disorder. And if you found this video helpful, please like, subscribe, and follow The Quiet Mind for more evidence-based videos on mental health diagnoses, coping skills, psychology, and practical strategies for building a calmer mind. We'll see you in the next one.